back to the Optimization Academy. I'm pleased and grateful and happy to welcome back Dr. Westin Childs. If you want more information, the background of Dr. Childs, go back to part 1, but I will say that he has an amazing website, restartmed.com if you want to get technical. And it is a treasure trove of information on thyroid health, hormone health, weight loss, metabolism, any subject that you want to know in that realm. It's on there in great detail, and it is a pleasure to welcome him back. So welcome back, Dr. Childs. How are you today?
I'm doing awesome. It was great. That first discussion is really good. If you have any sort of thyroid disease, highly recommend you check it out. Not just tooting my own horn here, but I think it's good. But yeah, excellent, and happy to be here.
Great. So in the first episode, we talked about signs and symptoms, how to recognize yourself if you're not feeling well, that it may be your thyroid, what lab tests you should look at, and also what are some of the root causes that lead to having a sluggish thyroid or hypothyroidism, and that includes autoimmune condition, Hashimoto's, all of that. We discussed that. Now that we have those pieces of the puzzle, let's talk about how do we get better. And I want to start this discussion because I feel a lot of patients come in with these conditions and what does your doctor have you do? What do they prescribe you? And they say, well, he put me on Synthroid or levothyroxine, and okay. And they're like, what do you mean and? There's no and, here's my medication, right? And okay, great. That's not treating the root cause. It's not helping you get all the way better. So let's talk about creating the thyroid master plan. So in your experience, when it comes to, so let's talk about creating that master plan. What are some of the components of that master plan to getting someone feeling better and getting back to health and their thyroid gland?
Yeah, that's a great question. And I think there's a couple ways to think about this. So number one, you have to think about, as you mentioned previously, is there a root cause, right? Is there something that caused my thyroid to be dysfunctional in the beginning? So that's number one. Number two, how effective can I be at treating and or reversing that root cause? And there are some things which are reversible and some things which are not reversible. For instance, if you had thyroid cancer and you had your thyroid removed, your thyroid's out. That's not necessarily a reversible condition, but there are things that can be reversible. So you have to think about, is there a potentially reversible cause, and is that, or what was I saying before? Let me go back to that for a second. I lost my train of thought. Sorry. Okay, so you have to think about, what is the cause and whether or not that cause is reversible, because some things are reversible and some things are not. So that's really how I would structure the way to think about, how you pursue and how you look at your treatment plan. Now, what are the areas that you want to look at? Now, that is highly individualized. And so, as I mentioned previously in the first session or first section that we talked about, each person's going to be a little bit different, right? There's no cookie cutter way to approach thyroid management. Each person's going to have a different cause, and each of those causes are going to be different. And so that requires some evaluation. You need to go to a doctor like Dr. Jones or somebody else who can look at you in this way and take a full body approach to it. But I would say there are certain elements which are always important to look at. And so number one, and I'll just kind of go through these, and if you have any that you want to add, Dr. Jones, chime in and we'll talk about these. But I'd say number one would be you need to look at thyroid function. How well is the thyroid function? Are you able to produce thyroid hormone? And that will inform you as to whether or not you need to be taking thyroid medication. Because believe it or not, there are many people out there listening to this as well who have thyroid dysfunction who may not necessarily have to be taking thyroid medication. There may be some element in which you can reverse that, or maybe you were prematurely put on thyroid medication for the wrong type or the wrong reason or whatever it is. So you may not necessarily have to be taking it. So that would be number one. Is your thyroid gland producing thyroid hormone, and do you need to be on thyroid medication? Yes or no. Then you need to start looking at how is the thyroid impacting other organ systems in the body? Because this is, I mentioned in the first section here as well, that the thyroid hormone itself impacts just about every cell and just about every system in the body. And so you're going to have downstream effects from that thyroid dysfunction in just about every area of your body, right? You're going to have problems with estrogen and progesterone to some degree. You're going to have problems with testosterone. You're going to have problems with your weight. You're going to have problems with your brain and whether or not you have depression or brain fog. You're gonna have problems with your gut because it's gonna slow down your gut. You're gonna have problems with a number of different areas. So you have to look at these things and determine, did I have a problem there first, which caused my thyroid problem? Or do I have a problem which was related to that area secondary to the thyroid dysfunction that existed? So I would say, look at those other systems, check out your thyroid gland and whether or not it's producing thyroid hormone, check out those systems. And then I would say another huge one would be gut dysfunction. You have to be looking at your gut. A lot of disease or thyroid disease starts in the gut. Actually, really just any disease starts in the gut, to be honest, but especially thyroid dysfunction through increased intestinal permeability, which, we kind of refer to as leaky gut, but you get this thing called molecular mimicry. If certain things get in through the gut, which can trigger Hashimoto's thyroiditis. So that can be a big root cause. But don't forget as well that thyroid dysfunction can cause slow gut and gut problems. So it's kind of a chicken and egg thing there. I don't think we talked about this yet, but you also want to look at cortisol and adrenal function. There's a connection between your adrenals and your thyroid gland. You need to be looking at, of course, lifestyle, just your lifestyle in general. What type of foods are you eating? Your diet impacts, regulates, or helps to regulate inflammatory levels and how well, you're absorbing nutrients into your body. You need to be looking at how much you're sleeping, right? Are you getting 8 hours of sleep per night? Or are you getting 4 to 5 hours of sleep per night? One of those is good and one of those is bad. And I don't think I need to tell you which one it is, right? You need to be looking at, are you exercising? Another really important one is fasting. Like, is there a period of time in which you're eating food and is there a period in time in which you're not eating food? So when you really start to break this down and look at it, a treatment or paradigm or a treatment regimen for somebody who has thyroid dysfunction should be multifactorial. It should take into account gut function, thyroid function, immune system, nutrient deficiencies. You should be looking for those things. Autoimmune dysfunction, like is your thyroid dysfunction caused by an autoimmune disease? And all of these things that we just mentioned previously. So I know that's kind of a laundry list of things and we could dive into these in more detail, but that's really how I would say, if you want to feel better, if you want to get, really reverse your condition, that's where I would start.
Yeah, and it should be a laundry list. I mean, because again, that laundry list is going to be different for every person. Because we may have people listening that are like, "Wait a minute, I work out all the time. I get great sleep. That part, okay, you're good."
Yeah.
Let's look at the other things. Look at gut health. And gut health is so important to this discussion. I mean, just you think about leaky gut, you think about how it affects our mood, and just how many autoimmune conditions have a gut dysfunction portion of it, and just understanding that piece. So never forget that. Now, something we didn't mention in the first part, and how diet is because with our patients that have with our patients that have Hashimoto's, we say, hey, gluten is out for you. You need to be on a gluten-free diet. And there's okay. It's like, because again, you mentioned molecular mimicry, that gluten, your body thinks those antibodies thinks it's TPO. And so potentially making that condition worse, not to mention the inflammatory piece of it. And dairy is another big piece as well, just making sure we're avoiding all the inflammatory foods. So I think that diet is a big part of it, along with gut health. Then the adrenal glands, again, I definitely want to have you back on here. I want to save adrenals for the next time, because that's such a big thing. Because we were talking earlier how it's like a lot of times in med school, especially traditional medical school, we think about the adrenal glands and like, oh, it's going to make these hormones, but it's almost forgotten about. It's not just theoretical, like, no, this is affecting your cortisol and your androgens and affecting your and your cortisol levels and all that. So just want to make sure we're able to address that. So part of that plan, okay, now we're looking at the the foundation setting, and that's something I talk about with my patients, about setting your foundations for health. You mentioned a lot of them: sleep, diet, exercise, stress management, all of that. Now that we have our foundations, let's talk about how to actually treat the thyroid. And so in this portion, we're going to talk about the different thyroid medications, the differences between those, and then, what your thoughts on. And then again, and I know we're going to talk about this again, that what's good for the goose is not good for the gander. Some people may do very well on natural thyroid, on natural desiccated thyroid. Some people not so much. We're going to talk about that. So I'm going to turn it over to you, Dr. Childs.
Yeah, no, and as you mentioned, we could really go into detail on a lot of these things. I do want to circle back just real quick in terms of treatment, because you mentioned and you talked about diet, and I think that we can't have a discussion on managing the thyroid without at least going into a little bit of detail on the diet. And the reason is simple: the diet, what you put in your body, what you put in your mouth, is completely under your control. So if you're listening to this and you're thinking to yourself, what can I do? You may feel powerless because your doctor is the one ultimately who has the prescription pad. And if you think or you believe that the only way for you to feel better is through the use of prescription medications, you're going to miss out on the fact that you can impact your disease course and how you feel through your diet. Now, Dr. Jones mentioned some really important things. So I would say top 3, if you're walking away from this podcast and you want to know, what should I do? Get rid of dairy, gluten, and soy. If you have a thyroid problem, start there. Okay. Yes, you may need to do other things. There's plenty of other diets. We have AIP, we have the elimination diet, we have Whole30, we have even ketogenic diet can be beneficial for some of these patients. So who have thyroid conditions. But if you don't know where to start, at least start with dairy-free, gluten-free, soy-free. And it's crazy how, it may sound, it may just sound silly to you, but I have seen so many patients. There's even a number of patients who get completely almost better, just with that dietary change, right? So I want you guys to take that away. Now, as we're talking about treatment though, I still think that there is important, and I'm going to, now we're going to get to the topic that Dr. Jones mentioned here, and that is thyroid medication. Okay. And so there are going to be people who require thyroid medication because their thyroid gland is not producing enough thyroid hormone. That is the reason to give somebody who has low thyroid function, thyroid medication, right? Because what is happening is your thyroid produces a certain amount of thyroid hormone every single day. Now, imagine you have some damage or dysfunction function to that gland because it's inflamed and damaged and suffers from some destruction due to Hashimoto's thyroiditis, which is the autoimmune disease. So imagine now, instead of producing 100% thyroid hormone, it's producing 80%. Now we have a deficit of about 20%. Now I will tell you from experience, and I'm sure Dr. Jones will agree here, you will feel that. Okay, if you are 20%, if you have a 20% reduction in thyroid function, you will feel that symptomatically. And that is the case for using thyroid medication to, adjust for that 20% deficit to give your body back what it needs. Now, there's a little bit of a game you have to play when you take thyroid medication, and that is you are suppressing your body's natural ability to produce thyroid hormone as you take thyroid medication through the feedback loops, which feed back to your pituitary gland and into your brain and to your thyroid gland. So it is a little bit of a give and take, and we can talk about that. And this sort of informs us how you get off thyroid medication later on, and if you can get off thyroid medication and so on. But I at least want to mention these things because you should be aware of these things if you're a thyroid patient considering taking thyroid medication. That's why I always talk to patients. I say, hey, how do you want to treat this? Do you want to do a natural approach or do you want to just go straight into medication? The natural approach is better in the sense that, you can do, as Dr. Jones mentioned, lifestyle interventions, diet, exercise, stress reduction, sleep, et cetera. You can do that. And a lot of people will see improvement. It's not clear in every single case how much improvement you'll see. But if you prefer a little bit of a quicker approach, you can use thyroid medication. And this is good for people that really want to see results quickly, right? If you want to boost that thyroid up almost immediately, I could, you can get a prescription for thyroid medication and that will do that job. Now, when it comes to thyroid medication, there are a ton of different types of thyroid medication, but you wouldn't know that if you were a thyroid patient because your doctor is probably only prescribing one thyroid medication, and that is a T4 only thyroid medication called levothyroxine or Synthroid. And so we alluded to this a little bit earlier, and it's something I at least want to bring up here, and that is the big problem with these medications, levothyroxine and Synthroid, is that they are not active as you take them, as you swallow them, and as they get into your body. In order for your body to use these medications, which by the way are 90+% of all medications for the thyroid consist of these medications, your body must activate them through something called thyroid conversion. And so a lot of people, they don't do this thyroid conversion process well. So even though you're taking thyroid medication, your numbers look good, quote unquote good, you're still not actually feeling good because your body's not activating it. So you need to understand that aspect of thyroid medication. Your doctor's probably only going to be giving you one type, and it's not really even the best type of thyroid medication. Now, Dr. Jones, did you want me to sort of get into the different types of synthetic versus natural desiccated versus compounded and things like that? Is that what we kind of had in mind here?
Yeah, let's keep it high level though, because again, we can get way into the weeds on that. So just so we know the difference, so they know, okay, this is what I'm taking and all that stuff.
Yeah. So let's say this then. When it comes to thyroid prescription medications, you should at least kind of have two classifications or two categories. We have the T4 only thyroid medications in levothyroxine and Synthroid, and then you have another branch of medications, which most doctors aren't aware of, and these are what a lot of people refer to as natural versions of thyroid medication. So this would include things like WP thyroid, NP thyroid, Nature Throid, and you can actually compound desiccated versions of thyroid medication as well from compounding pharmacies. And these medications tend to work a lot better than the other ones because they contain a combination of T4 and T3. So they contain that active thyroid hormone medication. Now, I should say this though as well, people are having a lot of issues in getting some of these prescription medications, the more natural types, because of recalls and other issues with the manufacturing process and so on. But that's really how I would think about treating your thyroid with the use of thyroid medication.
So that we're educated and our patients are educated, what are the optimal numbers for thyroid levels that you're looking for?
Yeah, that's a great question. And it's something that, you're right, we kind of briefly touched on in our previous episode, but something that we should go into a little more detail here. So I kind of want to talk about two different things here, just so that you kind of understand it. And if you're a patient listening to this, you kind of get it. But on one hand, you have these values. So you have your lab values. You go in, you take the phlebotomist takes some blood out and they spin it up and they look at it and they determine how much free thyroid hormone is there, how much T4 is there, how much T3 is there, and so on. And you can look at these values and you can determine how am I going to do some treatment, okay? That's one aspect, okay, on one hand. On the other hand, you have how you are feeling clinically. Okay, so there is a mismatch sometimes between what your labs show and how you are feeling clinically. So there are plenty of people, I've seen this before, I'm sure Dr. Jones has as well, many people who have labs that look abnormal, but they actually feel good. And then we have other people who actually look normal, but actually feel very poorly. Okay, so you have to sort of figure out where you fit into there. Now, another thing that I mentioned previously is if you were to line up 100 different people and you were to look at these people, you would see variations in skin color, eye color, height, weight, where their body distributes fat, and so on. You'd see variations in these people at all different levels, and that same sort of distribution and variation exists in patients with thyroid function and in how their levels manifest to them. Okay, so what you need is what you need really depends on you as an individual. Now, having said that, there are some general and rough guidelines that you can use to make sure that you are feeling better, right? So if you go to your doctor and you say, hey, your doctor, you're saying, hey, I feel really bad. I'm gaining weight. I have a lot of fatigue. And your doctor says, well, let's check your thyroid. They check it and they say it's normal. And you're like, well, I definitely don't feel normal. Here's what you can do. You can look at your lab values a little more closely. And we're talking here about the difference between normal lab tests and optimal thyroid lab tests. So if we want to focus on the optimal thyroid lab tests, which aren't perfect, by the way, but they're a good way of looking at it. I would say for the TSH, you want any value that is less than 2 to 2.5, okay? And greater than about 0.2. So if we're looking at that, it's what? Greater than 0.2, but less than 2 to 2.5. There are new studies which show that that's a little bit of a better optimal range. And I tend to think that people feel a lot better if they are naturally not on thyroid medication less than this range, okay? Now, unfortunately, your doctor's not going to say anything is abnormal on the TSH until it's greater than 5. And in some cases greater than 10, which blows my mind. We're talking, 2 to 4 times the range that most people feel good on. Your doctor's not even willing to touch you if you're in that range. Okay, so that's a TSH. Then we have free T3 and free T4. When you look at these ranges, you'll see values. So if you have your blood test in front of you, you're looking at them, you'll see a range of something like, it's different for every lab test because that's how they create them. So I can't give you a specific range, but I can break it down into percentages. So let's just say your range goes from 1 to 5. So if you break that down, it's about a 4, the delta between 1 and 5 is 4. So if you were to take that and split into half and look in the top 50th percentile range of those lab tests, that's where you'd want to fall. Okay. Most people feel a lot better when their free thyroid hormone levels are as high as they can be without really going over that upper limit of the edge of that lab test. So again, it's going to be variable depending on which lab you use, LabCorp, Sonora, and the people around that you're being tested with and so on. That's how they gather that data. But if you're in the top 50th percentile of that range, most people feel better there. Again, it's not 100%, it's not a foolproof method, but it works well for many people. And then when it comes to the thyroid antibodies, we talked about those tests previously. You really do not want those to be elevated in any way, shape, or form, right? That's just an indication the immune system is dysfunctional. You don't want those to be elevated at all. So that's kind of how I would think about those optimal lab tests.
Yeah. And 2 things I do want to touch on is that you're absolutely correct. People, we're not numbers. It's not, if you only look at the numbers, like, oh man, you're great, you don't need to be here. But if you still don't feel well, just know that don't just accept that my numbers are good and I'm okay. So we need to look a little deeper as physicians, as doctors, and say, hey, what is really going on? And then the other thing to think about is that I like that piece about the antibodies being elevated. You should not have any antibodies against your body, against anything. That should not be there. It should be 0. Should be none. So we have to take even those small numbers, even if they're less than the value, and say, hey, something's going on. You may not have enough antibodies to classify you as true Hashimoto's, but you shouldn't have any of them. So let's figure this out before it gets worse.
Yeah. Let me just say this too. When we talk about this stuff, like Dr. Jones was mentioning, everything exists on a spectrum, right? And before you develop full-blown Hashimoto's, which is the autoimmune disease, you're going to have a little bit of Hashimoto's, right? And then that's going to grow and grow and grow and grow and grow. Wouldn't it be good to catch that early? Right? To catch that before it happens. And that's what Dr. Jones is talking about here. He's saying, hey, look, even if there's a range, right? For antibodies, it's usually something like less than 20 or less than 30. But what if you're 19 or 20 or 21 or whatever? What if you're just right on that cusp? Well, that could be an indication that the body's ramping up, but hasn't quite gotten there yet. Right. And that would be, if you can catch that early, that's way better to catch it now before it gets to 2,000. Right. That's essentially what Dr. Jones is saying. And yeah, if you can do that, that is the best thing. Right. What is the saying? It's an ounce of prevention is better than a pound of, wait, what is it? Anyway, I don't know.
Better than a pound of treatment? Wait, no.
I don't know. It doesn't matter. Right?
Let's just make it.
That's fine. Yeah. But you know what I mean. You know what I'm saying.
Yeah, exactly. So
I didn't mean to interrupt you though. I just
no. That's fine. That's fine. So this kind of actually leads us to the next part here. Because this is how I actually found Dr. Childs, because I had a patient and, we started on thyroid meds and she wasn't Hashimoto, she wasn't autoimmune, just had some other things going on. She was feeling, I was like, look, we want to do this temporarily just to kind of get your thyroid, give it a little kickstart, get everything taken care of, and then we're going to come off of this, right? So the thing about medicine is that, again, in schools, and they're great at teaching us the science, the theory, how to diagnose, how to prescribe, or whether that be natural approaches with supplements and other treatments or medication. But one thing they do not do is teach you how to get off of that. So it's like, we can start a war, hard to get out of it, right? And so this is what I got. So I'm like, okay, I need to find this. I don't see it in my notes anywhere. So I literally Googled how to take a patient off thyroid meds. And the first website that popped up was Dr. Child's website. And so I was like, oh, look at this. This is great. Then I just started reading everything, right? So let's talk about optimizing thyroid recovery. So this means this can be, it's going to be a range, it's going to be a spectrum, like all of the things. We're going to talk about hey, how what are the things, or what should we look for if it's time to stop taking a thyroid medication, if that's an option for you. We're going to talk about hair loss recovery. We're going to talk a little bit about metabolism. It's going to be very high level because each one of these things, it could be its own podcast. So
Yeah.
let's talk about that.
Okay, I'll try and stay high level here because as you mentioned, we could go into detail. So let me say this. I think when you're talking about thyroid medication, we have to go back to what I mentioned previously. And that is, you really only want to be using thyroid medication if you are supplementing for what your body cannot produce on its own, right? You're basically giving back what your body can't produce or what it would be producing in a healthy state. But as I mentioned previously, when you do this, there will be a suppression in your body's own ability to produce thyroid hormone, right? You're basically, and that is greater than what what you're replacing to begin with. So imagine if you give somebody, let's say somebody has a 20% reduction in thyroid dysfunction, as I mentioned previously in my analogy previous. Imagine you're giving them, you have to give them more than that 20%, right? Because you have to kind of make up for it because there's going to be some suppression of the brain thyroid connection that occurs there. And so I don't want to get in too much detail about that, but just know that this occurs, okay? So you're over suppressing the thyroid gland a little bit during this process to give back the body what it needs. But as Dr. Jones was mentioning, the whole goal here is to repair and reverse whatever caused that low thyroid dysfunction to begin with. So let's imagine this hypothetical scenario, which happens to be true for a lot of you. Imagine it's gut related. Imagine you have leaky gut or increased intestinal permeability. You have something called small intestinal bacterial overgrowth or some fungal overgrowth. You treat that problem, okay? You solve that issue. You've replaced some nutrient deficiencies such as iodine and zinc and so on, vitamin D3. You've cooled down the immune system. The thyroid is ready to be primed and it's ready to be functional, okay, in this situation. But you're taking thyroid medication, which is still suppressing your native thyroid function a little bit. So what are you trying to do here? You're trying to take away slowly the thyroid medication and see simultaneously if your body can then start producing the amount that it wasn't able to produce previously, okay? So you have to kind of do this in a little bit of a measured and safe approach, because if you were to just take that person off thyroid medication 100%, which is why Dr. Jones did not do this, he knows this, what's going to happen is your body's not going to be able to produce what it used to produce because it's going to take some time to ramp back up. Okay, this happens with testosterone replacement therapy. This is why you give men who take TRT, you give them usually HCG or some component to prevent testicular atrophy. You give them these things to prevent these issues from occurring, but they're still going to invariably occur. So it's a kind of a balancing game. So we're removing the thyroid medication in a slow and measured way to see how much and if the thyroid is able to completely replace those levels that were lost previously. Now, Dr. Jones was saying you got to do that the right way. You don't want to pull it off completely. So the best way to do this is you need to do it in what's called a tapered approach, or you need to do it in a slow measured approach over a period of time. So generally, and I'm gonna write a blog post, by the way. It's actually on my to-do list. I haven't got to it, so I'll give some more specifics on this. But generally, something like 20 to 25% reduction in thyroid medication dose every 2 to 4 weeks or so. You reduce down in sort of a stepwise way, and that can get you completely off thyroid medication while simultaneously giving your brain and body enough time to take over for the amount that it hasn't been able to produce. So that's really how I think about tapering it off. Now, and one other quick thing here too, which, a lot of quick things here, but this is one that's really important as well, is there's a lot of you listening to this who may or may not need to be on thyroid medication, but you won't know because you never tried, okay? And this is what Dr. Jones was mentioning, that we're just not taught this in medical school. When you get put on thyroid medication, it's a for life thing, right? And I have tons of people who have had reversals of whatever the underlying cause was, but they just stay on thyroid medication indefinitely because no one ever bothered to look or check. And there's a lot of people that can benefit from taking this seriously and trying to get off thyroid medication, because you don't want to take it if you don't have to. So that's how I'd recommend doing that.
It's a good point, man. It's like I've said that before to many of my patients, when it's like, if I understand there is some dysfunction there, and okay, we're going to correct these things, and I want to start this therapy because there's a reduction in your optimal output, this is not a life sentence here,
right?
Not for you. Right. So we want to think about that in the big picture of things. So now when it comes to, because again, there has been a suppression here, and think about some of those side effects that people get from thyroid medication.
Yeah.
One of the things that I deal with a lot with hypothyroidism is the hair loss piece of it.
Yeah.
It's because, okay, that's one of the reasons why many people come in. It's like, hey, I'm losing hair. And then we, go through the symptoms, understand what it is. So now we got a lot of the repair going, whether it be improving their gut health, improving adrenal health, et cetera, et cetera. And now we're trying to recover that, because the hair is a big thing, man. I'm very lucky. You're lucky. Got a lot of hair. A lot of people don't. It's important to them, and I understand that. I respect that. So what is a general strategy for recovering some of the hair loss that people experience from hypothyroidism?
Yeah, and I would say if you're going to see Dr. Jones or someone like Dr. Jones, your experience is going to be completely different than the experience you're going to have seeing a family practice doctor or an endocrinologist. I just want to be very clear about that, because it really sort of depends on what type of doctor you're seeing here. But I want to mention hair loss, and as Dr. Jones mentioned, is a serious issue. And I know this because I've had a lot of people who, especially women, if you lose 25 to 40% of your hair, it's not as thick as it was before. That's a big deal. And so I respect that. I will say that the hair loss component tends to be a little more difficult and a little bit trickier, and I'll explain why in just a second here. And part of that has to do with the fact that hair loss and hair growth can be influenced at different levels of thyroid function, and your thyroid medication can also influence it. Okay, so basically it can go like this. Too much thyroid hormone can cause hair loss. Too little thyroid hormone can cause hair loss. And also, the thyroid medication itself can cause hair loss just as a side effect, irrespective of the dose. And the nutrient deficiencies that your thyroid causes, just by virtue of having low thyroid function in your body, can exacerbate hair loss. So we have really 4 important things that you have to be looking at if you are a patient suffering from hair loss. First of all, look at your dose. Make sure you're not taking too much. That's probably not an issue for most of you. I would say that's, minor. That tends to not be something that most people deal with. Most people, on the other hand, are not taking enough thyroid medications. Right? They're usually they're not replacing enough that was lost. So instead of going from, in my analogy previously, 80% to 100%, they went from 80 to 85%, right? There's still that 15% deficit. They haven't replaced it, right? So that's a common cause. The next one is you have to look at the thyroid medication itself. Is it coming from levothyroxine, Synthroid, Cytomel, et cetera? All of these medications, one of the side effects is hair loss, again, irrespective of dose. So you have to look at that. And sometimes it's as easy as just swapping between thyroid medications, and that solves the issue. And then lastly, you need to be looking at nutrient deficiencies. Zinc, selenium, ferritin, iron, those kind of things are very important as it relates to hair growth. So you have to be looking at all those. And lastly, remember, autoimmune diseases tend to go together. So there are autoimmune conditions your immune dysfunction or your immune system itself. If you have something like Hashimoto's thyroiditis causing your low thyroid, you may also then get autoimmune aspects of hair loss. So that can be influencing what's happening with your hair as well. So it is complicated, but if you look at those 4 or 5 areas, however many I mentioned there, that'll give you the best results. And still sometimes it's very difficult. But I've had a lot of success. I would say probably 70% of people at least using this approach can see significant improvements in their hair. So that's how I look at it.
Right. Now, something that I actually listened to one of your podcasts and mentioned, what triggered my thought on this is your thought about where you're mentioning that too much thyroid, too little thyroid. A couple of the supplements that people take that are great for hair loss, too much of a good thing, right? I think biotin's a big one.
And selenium.
Yeah, I've heard the other one too. So.
Yeah, I totally forgot to mention that. That's actually a really good point. So you can over supplement and cause hair loss. And it's kind of simple, right? Because if you think to yourself, oh, I know biotin, it's important for hair growth, right? And you're like, well, if 5,000 mics of biotin is good, how about 10 or 15 or 20, right? And if you overdose on biotin, that can exacerbate hair loss. And another important one is selenium. Now, selenium actually helps prevent thyroid gland inflammation, right? It supports the production of something called glutathione, which cleans up free radicals and reduces damage to the thyroid gland. But if you take doses that are too high, you can get selenotoxicity. Usually it doses somewhere between 400 mics to 600 micrograms per day. You need to be taking, relatively high doses of selenium, can cause hair loss and exacerbate as well. So yeah, it can be confusing. There's a lot of different causes, but you should be aware of all those things.
Great. Excellent. So, well, man, this has been great. Thank you again, Dr. Childs. So I hope everyone is going to take away something great from this and be able to understand their thyroid function, how to recognize it, how to be tested for it, what are the root causes, how to create an overarching or complete whole person approach to the treatment plan, what the medications are, how to recover from it. I think this should be a great foundation for anyone that is going into their journey with their physician on how to improve the thyroid function or treat hypothyroidism. That being said, Dr. Childs, I know we mentioned this in the first one, but where can we find you?
Yeah, so just search my name, Dr. Westin Childs, or go to restartmed.com and you'll find all the information I have. And as I said previously, I really just want to produce information that's helpful. That's really my goal. That's what I do. So you can find hundreds of blog posts, lots of podcasts, lots of videos, et cetera. So if you like this sort of stuff, I think you'll like that.
Great. And the other thing that you've been a little humble about it, but you have a great supplement line. And can we talk about that for a second here?
Oh, yeah. I forgot to mention that. So I sort of have a big line of supplements which help specifically target thyroid conditions. So they're created and formulated in such a way to target different aspects of thyroid function. I've had a lot of success in helping people with that. I will say, though, when it comes to supplements, remember, supplements are just that. They're supplements, right? And so when you think about supplements, they're not cures by themselves. They should be used with diet, lifestyle, stress reduction, all the things we're talking about, even thyroid medication and so on. But they absolutely can be helpful. I know Dr. Jones uses them. I think you'd be crazy nowadays to not use supplements in addition to everything else, right? I can't imagine people that are getting the amount of nutrients they need through diet, even eating organic and whole foods. I just think that's very difficult to get the proper amount of nutrients that you need. But that's my personal opinion. So, but anyway, yeah, you can check those out if you're interested in that.
Great. Well, hey, man, it's been an honor and a pleasure. Thank you for making time for this. I think anyone who's listened to part 1 and part 2 is walking away more educated and with a wealth of knowledge here today. So that being said, thanks again. For those listening, you can find us on everywhere. This will be on YouTube. It'll be on iTunes, on Spotify. It'll be everywhere. I don't know, man, put it on TV. I don't know, everything. It's going everywhere, all the places that it's going. Excellent. But I want to say thanks again for this. And any questions, please, Any questions, any more information, any comments, leave it below, and we will make sure we try to answer it in the best manner possible. Thank you for listening. Thank you for watching, and we'll see you next time.